Hi everybody! Welcome back to the CHRG Therapy YouTube channel. We are so happy that you've decided to join us for today's video. My name is Lauren and I am one of the students in charge. The CHRG Therapy team is starting a new series on our channel called Know Your Nerves in order to help everybody have a better understanding of our median, ulnar, and radial nerves. Today we are going to be focusing on the ulnar nerve. I'm going to pass things off to my partner in charge, Megan, and she is going to go a little bit more in depth on what the ulnar nerve is.
The ulnar nerve has both sensory and motor functions. It provides motor innervation to part of the forearm and majority of the hand. It supplies sensory cutaneous innervation to the medial forearm, medial wrist, and medial 1 1/2 of the digits, being your entire pinky finger, and medial half of the ring finger. The sensory functions cover the skin over the medial surface of the hand through the superficial branch. The ulnar nerve and its branches send motor innervation to the flexor carpi ulnaris and flexor digitorum profundus in the forearm and the hypothenar muscles, which include the opponens digiti minimi, abductor digiti minimi, and flexor digiti minimi brevis. That's a mouthful. In the hand, the ulnar nerve provides motor innervation to the 3rd and 4th lumbricals, the dorsal interossei, palmar interossei, adductor pollicis, flexor pollicis brevis, and the palmaris brevis. The overarching motor functions of these muscles include finger adduction, abduction of the fingers other than the thumb adduction, flexion of the ring and pinky fingers, and wrist flexion and adduction.
We know that the anatomical pathway of the ulnar nerve can sound a bit daunting and confusing, but we are here to lay it all out for you. The ulnar nerve is derived from the brachial plexus, which we know is the network of nerves that sends sensory signals from the spinal cord to the entire upper extremity. The ulnar nerve is a continuation of the medial cord and contains fibers from spinal roots C8 and T1. From the brachial plexus, the ulnar nerve runs down the medial side of the upper arm and then passes through the medial epicondyle of the humerus and enters the forearm. After entering the forearm, the ulnar nerve goes through the two heads of the flexor carpi ulnaris, which we know is one of the flexors of our forearm. And then it travels alongside of the ulna. Here, there are 3 branches of the ulnar nerve that arise within the forearm. They consist of the muscular branch, the palmar cutaneous branch, and the dorsal cutaneous branch. The muscular branch is located in the anterior forearm and innervates the flexor carpi ulnaris, which does flexion and adduction of the wrist, and the medial half of the flexor digitorum profundus, which flexes the ring and pinky fingers at the distal interphalangeal joint, the top joint here, just like this. The palmar cutaneous branch innervates the medial half of the palm and supplies sensory innervation to the small area that is located on the palmar surface of the wrist. Lastly is the dorsal cutaneous branch, which innervates the dorsal or front side of the medial 1 1/2 fingers, that being your entire pinky finger, and the medial half of your ring finger, and the associated palm area supplying sensory innervation. To continue within the anatomical pathway of the ulnar nerve, we are now entering at the wrist. At the wrist, the ulnar nerve enters the flexor retinaculum on the palmar side of the wrist, and then enters Guyon's canal. The ulnar nerve finally terminates within the hand.
An ulnar nerve injury can be caused by a number of reasons based on location of injury along the course of the nerve, most commonly at the elbow. Nerve pathology can be caused by damage from fracture of the medial epicondyle, osteophyte infection, soft tissue mass, or synovitis at the elbow joint. The nerve may also be damaged due to compression from prolonged periods of elbow flexion like sleep, exercise, driving, typing, or talking on the phone. Proximal injury to the lower trunk of the brachial plexus can result in KLUMPKE palsy. Injury at the elbow may result in cubital tunnel syndrome, and compression at Guillen's canal of the wrist can manifest as motor and sensory deficits in the hand. KLUMPKE palsy is the manifestation of a lower trunk injury to the brachial plexus, this being an injury involving a combination of roots C8 and T1. Most commonly, lower trunk injuries are a result of an upward force or traction on the arm. KLUMPKE palsy has a functional deficit of the intrinsic hand muscles presenting clinically with a complete claw hand. Clinically, we can observe hyperextension of the MCP joints due to loss of flexors, radial deviation of the wrist due to loss of flexor carpi ulnaris, and wasting of intrinsic hand muscles such as the lumbricals, interossei, thenar, and hypothenar muscles with flexion of the dorsal interpharyngeal and proximal interpharyngeal joints. Cubital tunnel syndrome is a peripheral neuropathy due to chronic compression or repetitive trauma of the ulnar nerve at the elbow between the medial epicondyle of the humerus and the olecranon process of the ulna. Ulnar nerve impingement can also occur at the wrist due to compression through Guillen's canal, local trauma, ganglion cysts, and external nerve compression. The ulnar nerve and artery enter Guillen's canal, which is a fibro-osseous tunnel formed by the pisiform and hook of the hamate. The ulnar nerve divides into two branches within the canal, which are the superficial and deep branches. Nerve compression at the wrist can also be caused by bikers with excess pressure from handlebars and prolonged compression while typing at a desk. Diagnosis of ulnar nerve injury can be made with a thorough history and a musculoskeletal and neurological physical exam. However, electromyography, which is abbreviated EMG, and nerve conduction studies can be used in addition to diagnose and localize the ulnar lesion.
We hope that you all enjoyed the first video of CHRG Therapy's Know Your Nerve series, and now that you have a little bit of a better understanding of the ulnar nerve. Be sure to check in next time where we go over the median nerve, and remember to like this video and subscribe to our channel. You can even turn on your notifications to be sure to catch us in our next video. As always, we can be found at our website, CHRGtherapy.com. CHRG is spelled CHRG, the word therapy.com. And you can find us on Instagram at CHRG Therapy for daily tips and tricks. We'll see you all there. Bye!